obviously. I take their history, get information about whether they've had Botox before or any sort of filler or any sort of surgery to their face, because all that makes a difference in the musculature. I will talk to them about what their expectations are, what they want from the process. Then I will look at the muscles in their face, make my recommendations on what we should try for the first session. I'll take photographs to have before pictures, and then I generally underdose initially because I feel like it takes a while. Some patients are very obvious on their musculature, and I can feel the pull of the muscles very easily with my fingers. It's not a one size fits all. It's really looking at the muscles in their face and seeing how they're pulling. Botox relaxes the muscles. So it's not like you can point to a wrinkle and say, I want this wrinkle gone. Well, if I inject it here, you're gonna look like this. You're gonna look like a stroke victim. So you can't do that. You have to understand how the muscle pulls, and then you have to take the opposite muscle and relax that. So in other words, women as they age generally get downturned mouths. That's why we get those puppet lines down here. So what we do is there's two muscles. There's a muscle that pulls up and there's a muscle that pulls down. What we do is we paralyze the muscle that pulls down. But there's also muscles relating to that muscle that if you paralyze them as well, you'll get like one side of your lip dropping. So you have to understand how their muscles work, and you have to actually feel the muscles. It's not what I've seen so often is people go, well, where do I inject for this? No, it's not where do you inject for that. It's what's the muscle doing on that patient that needs to be paralyzed in order to have the other muscle take over and for our mouth to look like this rather than like this. Then after we decide that and make decisions, sign all the consents, I'll take pictures and I'll inject. The injections themselves really are not painful. It's a very quick stick. It's less than like a TB shot. I've done it on myself. I can tell you personally, I would never do anything on myself on somebody else that I wouldn't do on myself. And then 2 weeks later, we bring you back because you start feeling the effects 3 days to a week later. 2 weeks is max effect, so that's when you'll see the biggest effect, and then we can bring you in and see. And sometimes things happen where like a brow's a little bit uneven because your muscles pull unevenly. You may some people lift only one eyebrow, that kind of thing. So it's a feel for how your muscles are after 2 weeks, and then we correct any issues. Most of the time, I usually don't need to do any more injections after 2 weeks, but we bring you in just so I learn your face and learn your musculature, and then probably the next time we inject 3 to 4 months later, you probably won't even need to come in for the 2 week unless you want to, which I'd be happy to see you again.